in terms of people who already have a medical background and they move from Pakistan or immigrants in general, and they go to the West, Canada, US, UK. Obviously, there's a lot of people that get into the survival mode, like in terms of trying to just live through and get set. And then eventually what happens is that they don't follow through with their medical degree despite wanting to do it. So do you have any advice for people who are interested in coming to the West and want to pursue their medical profession, or are a little hesitant because they might not be able to because of the survival portion or staying afloat kind of situation?
Yeah, see, there are many challenges, and especially
Yeah.
for the US. Unfortunately, you may have been practicing for years and years, but when you come here, you really have to go through the steps all over again. So you have to do residency with some people, and there are like some people who are doing programs that have some sort of accreditation. You might be able to get away with a waiver of 1 year of training, but the American Board of Pediatrics does not, especially in pediatrics, I'm obviously most familiar with that, doesn't allow for more waiver of more than 1 year. And I'm sure most of the other specialty boards are the same way.
Yeah.
There is some time that you must do here before, and that's basic residency. Doing residency is essential because that's your gateway into the American healthcare system. Without that,
Yeah.
you can't practice medicine here. Although now with the pandemic and the extreme healthcare shortage, there are actually one or two states, I know Tennessee, for example, where they are looking at some other pathways where experienced physicians may be able to practice medicine as long as they are supervised. But there are many sort of caveats to that also. Definitely, it is difficult. So I think for people, though, I would say again, if this is something you really want to do, don't give up. You have to have the, again, determination. I think we are all hardworking, so hard work is not an issue. Just not getting disheartened by all the obstacles along the way and just continuing to find a way. And one of the other things that happens is if you come here and you don't get into a residency right away, which of course is also very difficult and challenging, there are many international graduates that go unmatched every year, then
Yeah.
try to find something else, something that is related to medicine. For example, maybe you can look at pursuing another degree. Maybe you can look at doing something in public health or maybe pharmacy or counseling. I mean, there's so many different venues that you can continue on that may ultimately then open a door for you to get into medicine. And you may decide along the way that, okay, I'm not going to practice, but I'm going to work as a pharmacist or I'm going to work as a counselor or something like that, which are all related to medicine. You're still providing care to people. And there's honestly, these days, there is just so much room and there's such a shortage of not just physicians, but all other allied health providers that I would say that's what I would suggest to someone who wants to continue doing what they're doing, but maybe can't get in directly. There are indirect ways, or you can just get into education. I mean, there is a
Yeah.
shortage of educators also. And part of what I do right now is medical education. And that's also very gratifying. Taking care of patients is one thing, but also educating the next generation of physicians is also, I think, a huge contribution that we can make. And physicians who have come with a lot of experience in their home countries, but then are struggling here, that is another way for them to continue to find like fulfillment.